My name is Chuck Thompson for World Emergency. We manufacture emergency disaster supply equipment for earthquakes, fires, floods, and civil unrest. We also design terrorist attack kits for terrorist threats. These kits, of course, are formulated with the basic things that you would need in such a threat or a terrorist attack, such as a gas mask and food and water. They're put inside a backpack system for easy transporting. They also have antibiotics as well as thyroid tablets for a nuclear spill or nuclear attack. Again, we can formulate these disaster kits for any scenario that you might feel that your company or your family or your office might be in, as well as the government employees. We currently have a proposal with the Transportation Department to supply that new office, all 80,000 new employees that have been proposed for that department, to have their own separate backpack system. So if they're out in the field or any of the general offices and their operation comes under attack, of course they will have the supplies that they need to survive themselves and of course to help others. We think these kits are vital for all government employees and again for general citizens throughout the United States to have the basic necessities of life in case there is such an attack. We also have a proposal with Homeland Security to put up emergency disaster centers throughout all of the major cities throughout the United States. These emergency disaster centers will have a police office, a fire department, of course, and a search and rescue team. They will have the local government offices, the local agencies, again, police, fire department, and search and rescue, as well as the federal government offices, such as FEMA, as well as Homeland Security and the CDC, and various other departments that would need to be a part of that center. Again, these centers are portable and they can be moved from place to place. So if there's a disaster in any given area, such as Los Angeles, Chicago, or New York, of course, those major cities within that state will have their own private emergency disaster center to be put in place at that time. And of course, those centers as well will have the storage areas for a percentage of the citizens that live within that given area to be given out such kits and backpack systems as well as supplies for whatever given emergency within that area. These disaster centers are vital for that, and this is what our proposal is to the Health and Human Services Department. We would like to place a medical center as well with these emergency disaster centers that we've proposed with Homeland Security. The Human Health and Services is vital to have their own office throughout the United States because, of course, any given attack could take place throughout the United States at any given time. The hospitals will be overrun, and this is why we think it is vital that you would have your own emergency disaster facility to be placed within the center, as well as an emergency disaster office and facility operations center at the hospitals themselves. When the outbreak of various claims of anthrax occurred early this year and late last year, the CDC was overwhelmed with such requests to be able to go out and examine those who claimed that they might have come in contact with a biological agent. Again, these centers could take care of those claims in any given state, in any given major city. The participant, of course, those who claim to have come in contact with such biological weapons, would then go to these centers. And these centers, of course, beforehand will be staffed with World Emergency staff members to take all the information down and to hand it over to the various departments or the CDC or whatever government agency that you would instruct us to do. Of course, it won't be overwhelmed because many times many things won't be taking place. But World Emergency will be there to staff these various department facilities, these operation centers. And when there is a massive attack or some type of situation where many people seem to be coming down with some type of biological sickness, Of course, they will come into and they will flood the hospital centers and the emergency rooms. And again, we don't feel that that these hospitals, well, we know that the hospitals are simply not ready to be overrun by a massive attack. And we believe that having a facility in that given area right next to the hospital would be a vital step in helping those who claim to be coming down with whatever biological sickness that they have. These centers, again, can be moved from place to place. However, we can place a 3-office center for the Human Health Services Department within just the parking lot of the hospital. Again, staffed by World Emergency, free of charge, no cost to the government. And afterwards, when there is an outbreak, of course, the CDC or other government agencies or the Health and Human Service Department employees will then staff these facilities. These facilities will be ready to go. They will be outfitted with everything that you would need to examine biological agents or situations given within that area. It has many different details to it, and we would like to explain them all in a formal presentation. And so we appreciate very, very much if we could have a meeting with your staff members, again, to discuss our proposal in detail. And you can email us at worldemergency@mail.com. Of course, you can view a lot of the products and services that we do provide on worldemergency.com. And, of course, you can give us a call. We certainly appreciate it at 1-800-947-7778. My name is Chuck Thompson for World Emergency. I'm looking very much forward to talking with you soon. Thanks again.